going to actually try a different format because I'm sure, like most of you in your own organizations, you kind of start the year in reflecting, in summarizing, and trying to figure out your direction. And that's kind of what we're going to try out today. So if you're new to my world of tons, who we are, we provide education, resources, we work on fostering collaboration and support other organizations and service providers involved in delivering transportation services. Whoa, I am not used to PowerPoint. I apologize. I never use it anymore. But anyways. So our focus really, as you can imagine, transportation for seniors and for really anybody in the province, it's a big topic. So depending where you are in the province, that can look totally different for you. So we really kind of our core foundations are that focusing on accessibility, safety, affordability, and definitely sustainability, because that's a huge part of the transportation spectrum. So my keen interest really is in starting these is the collaboration, because as we know with not-for-profits, as we know in the community work we do, the grassroots kind of bottom-up approach to problem solving really is where all the change happens and really where all of the great ideas come from. And that's my intention with starting these. So I want to bring your voices as service providers and your thoughts and perspectives to the table as we at tons and as we start our year. And sorry, I'm just trying to monitor the the entrance, the welcome box. But if you didn't see this and if you're just joining, drop in the chat where you are from, your name, how you heard about our transportation think tank. And I'll give the folks that just joined a second to settle in. I see why people usually have someone monitoring the chat box and all of those features. But yes, so in true spirit of starting a January, now that you kind of know why I have started these think tanks and why we're here today in terms of like really gathering input, I actually want you to think for a second and invite you to reflect. So if you don't have a piece of paper or something to write on, I invite you to do so now if you feel called to it. And I want you to just think about, why is it important that you are here today? And I know many of you are from various organizations across the province, with different lenses and different scopes. But why is it important for you to be here today? And something I'd love for you to consider is the impacts of transportation on you, perhaps those you serve, and just the world at large. Louise, I'm unable to open my mic. Maybe try logging out and then coming back in. Sometimes that helps. I'm not sure if anybody else is having the same issue. I know we have a few people joining by phone. Yep, Karina, you can go ahead. You're welcome to unmute.
I'm here mostly because, well, as a town councilor, I kind of feel like our handy van service is underutilized. We currently offer it as a pay-per-service use, so people can just call, book the appointment, but I also feel it's cost prohibitive for our seniors or those living on a fixed income. So I'm kind of hoping I might learn some information in regards to helping convince my fellow councilors that maybe we should be considering a shuttle service a few times a week to be able to maybe offset that by offering a lower rate, as long as they're using it during those shuttle hours, something like that. So I guess I'm just trying to learn how to better utilize our handy transit in our rural community.
Yeah, and that's a wonderful topic. I don't know if we'll get super that specific, but the next question might help you with that as we move on. But thank you for sharing that. To me, when I hear that, it speaks really of that advocacy role of those who you serve in your community, but also like that collaborative nature of bringing more voices and hoping we can get our wonderful counselors and municipal counselors on board with transportation. Is there anyone else that wants to share? Why is it important for you to be here today? We have a lot of new faces.
Hi, I'll take a swing at it. So my name is Eval Friesen. I'm with CAA Manitoba. As a member-driven organization for almost the past 100 years, our primary focus has been road safety. Far from being car-centric, we are obsessed with the safety of all road users. So our mandate is vast and broad, and whatever we can do to contribute to greater safety out there on the roads is something that we're willing to take on. Thank you.
Wonderful. Thank you so much for being here. It's been great actually to learn about CAA and your role in Manitoba. I think we far underestimate the value you guys have and the input and the reach. So thank you so much for being here. Heather, I see you have your hand raised.
Thank you. I like the first speaker. I represent the Seine River Services for Seniors. I'm the board chair, not the senior resource coordinator. But we're in a we're not in a very, very rural area, but rurally diverse because we represent or we cover seniors who live independently in the rural municipalities of St. Anne and La Broquerie, and the people who live in the town of St. Anne, but there's a seniors home in St. Anne. So where there's a population density of seniors, transportation is not a huge issue. They have volunteer drivers, but we represent the seniors who live more remotely. And we happen to live near a big city, i.e. Steinbach, that has a handy van, and it's not accessible to us. So we have a mishmash of transportation options for seniors, and the biggest and the largest prohibitive nature of that is cost. And the cost of taking any public transportation. There's a private company that does a van to Winnipeg. So there's no other sort of public transportation other than friends, family, and our volunteer drivers from 3 different organizations. But even then, the costs are prohibitive for seniors who are living on fixed income and living in their own homes in a relatively remote part of our region. So every time we talk about transportation cost, it comes up frequently.
Yes, thank you so much, Heather. And Heather is one of our valued TON board members, and she always brings such a depth of knowledge and wisdom for her community, and definitely is what we call a community champion. So thank you so much for being here, Heather, and sharing that. Does anyone else have any thoughts they want to share? Why is it important for you to be here today? Whether it's for you or organizations you serve or the world. Awesome. Kirby, I will read out what you shared. I am here as an intersectional ally, and the needs of persons with disability and the senior population have similar needs, and I have the capacity to help all of you awesome folks who support seniors. I'm also vision impaired and unable to drive, so this is also personally important. Thank you so much for sharing that, Kirby. That's really, I love that you're in our circle. I love that you're connecting with us, but you're so right. So many of the issues, I know we at TONS focus on transportation for older adults, but truly it's for everyone. And that's what I love about kind of the age-friendly principle, in that if we do it well for older adults and we do it, then we can do it well for everyone. So thank you so much for sharing that. Sorry, I'm losing the hands. Hold on one second. I think I saw Melissa. Melissa, do you want to share?
I kind of quickly commented in the chat, but I can expand on it a bit. I totally agree with what Kirby said. So I'm the executive director of MLPD. We primarily work with people with disabilities, but we also work with seniors and seniors that have disabilities too. Um, I am a paratransit and transit user myself. And when I hear things like the city telling us that they're about to make cuts here in Winnipeg, and I hear things like the province telling us that they don't have any money to spare. One of the first things that sort of sets the hairs up at the back of my neck is that transportation is going to be cut for seniors and vulnerable folks, because there's a lot of assumptions about, I think, more availability than actually exists in reality. I think we need to do a better job at, like, and when I say we, I mean like MLPD and groups like mine need to do a better job, I think, at like making the general public more aware of like the reality of paratransit in terms like that, because often when I speak to folks that have no contact with services like that, they assume that they're more available than what exists in reality. So I'm not feeling scared, but I'm definitely on guard right now in terms of what's going on with transit and protecting what we have.
Yeah, thank you so much for sharing that, Melissa. I've appreciated getting to know you because you bring also the perspective, correct me where I'm wrong, from Toronto, is it?
Yeah, I've spent all my life well, I spent the last 12 years before I moved here a year ago in Toronto, and spent some time in Northern Ontario and Southwestern Ontario as well. So.
Awesome. So you bring just like a diverse perspective, and I've appreciated that because we often think in the transportation world, we have to innovate from the ground up, when in reality, we actually have to just look around at what others are doing and make kind of like a made in Manitoba perspective. So thank you for sharing what you shared. That's going to come in really, really handy when we go to our next question. But before I move on, okay, I have another comment from Simran, and I apologize if I'm saying your name wrong. I am the accessibility coordinator, new to the role, department, and also to the city. Thus, is it essential for me to be a part of these valuable discussions to gather inputs in understanding the needs of our seniors using transit services. I'm strongly passionate about accessibility and have been involved in the disability studies and diverse initiatives. It is extremely important for me to know the needs from the user experience. You are definitely in the right room then, because we definitely have great advocates in here that can speak to the experiences. I think someone is writing on my screen, but that's okay. I like it. I appreciate your art, but to be honest, I have no clue how to take it off there. So we're just going to leave it there. Awesome. Okay, so we are going to move forward unless there's any other comments. And also, as we continue on, please feel free to just drop them in the chat. As I did share, my focus today really is to help us as tons, but also to help many of you in kind of drilling down, because I know, like, in listening to each of us speak, the issues run so deep and so vast. But I want you to just think about from the next question. Hold on 1 second. Oh my gosh. I might have to change my controls. So this is the second question, and this one we are actually going to move into smaller group discussions. But before we do that, based on your perspective and learned experience in your community, for 2024, what are your top 3 transportation priorities that you'd like to see focused on to enhance the transportation options for older adults? But keep in note, older adults it's not like, let's just focus on maybe your organization, because again, as we know, older adults, really, it can cover everyone. So just take a moment, kind of reflect on this for yourself, and then I'm going to put you into breakout rooms and their group, or it can be multiple people in a group. Thank you, Ewell, for joining. I appreciate it a lot. Was there any top 3 priorities that want to be shared? And you can either just unmute or raise your hand. Serena?
In our group, we're group number 5. There was a lot of discussion on advocacy and education, and whether that's advocacy in the city of Winnipeg or whether that's advocacy to different levels of government, so advocacy on transportation and the need for transportation, and then a discussion about like scheduling and making it more efficient.
Advocacy, education, and efficiency. I like that. That's wonderful. Does anybody else from group 5 want to add to Serena's comments or any thoughts that stood out to you? Heather gave a thumbs up. Awesome. And I think Ewald was in your group as well. Did he have anything from a CA perspective that stood out for him?
I think one of the main things he said is that just advocate. CA does a lot of advocacy, but there hasn't been that bridge to rural advocacy. So they do a lot of City of Winnipeg advocacy, but the rural advocacy is something that we were kind of discussing how that might work.
Wonderful. That sounds like a good discussion. Awesome. Okay. Thank you for sharing. So is there anyone from, oh, Kathy, you can go room 3.
So I was in a room with Renee and Melanie. And so we were talking a little bit more specifics, some of the gaps that we've noticed, the grocery shuttle service that used to be available that is no longer, since COVID hit, it has not restarted. And it sounds like some of the grocery stores that used to be involved in doing this are not interested in restarting a shuttle like this. We also mentioned the Gwen sector transportation program that again used to be available, but the medical transportation program that is no longer running, and how well it did run, and how many of our clients sort of appreciated that service, and just how easy it was to use, the fact that it was door to door and they invoiced rather than having to pay at the time. And then the last thing was, and I should remember this because I brought it up. What did I bring up?
You talked about NERC and like the leftovers program.
Yeah. Well, looking at those partnerships and seeing, because there are some community groups that are a little bit more sort of spread out with a larger network. And so talking about a grocery shuttle, I know some of the things that some of the challenges are the cost for one organization to try to manage that, and if there's a way to pool the resources. The other thing that I wanted to kind of at the last minute I had asked was anybody's experience on the senior transport program that, by all things that I've read on the website, it's supposed to be a free program, kind of a pay as you go, or pay as you're able. But I had a client just a couple of weeks ago who tried to book a ride and was told that it's $25 one way. And so I'm hoping that the broader group maybe has more information about that, because I have been directing people to that senior transport based on kind of some of the shares from network members.
I can
So that
speak
was
to
kind
that one,
Mhm.
Kathy. Thank you for sharing all your other points, but I'll speak to the seniors transport. So that organization, I'm not going to speak to whether they're good or bad or that kind of aspect of it, but there have been a lot of challenges regarding that program. So this is the challenge in transportation. There's limited options. So I know we try to encourage like all of these organizations, but I would recommend, how do I want to say that? Maybe not referring to them. There are specific guidelines and bylaws that are enacted in the city of Winnipeg, and they don't typically, they fall in a crack, and that's all I'm going to say. So although I've heard really great things about their service, I've also heard some really bad things about the service. So like any transportation thing, I would just maybe steer away from not using them, if I can be as polite to say that. But thank you for your points. I appreciate that. Is anybody else from Kathy's group want to add anything else? Melanie or Renee?
I think just the difficulty, it's Renee talking. I think just like the difficulty of even like getting onto getting like onto the handy transit program. We'll have clients that like, I know that because like with our program, like we have like access to like occupational therapists, and just the difficulties that they've had that getting clients like in the program, and just the fact that they'll like set up an appointment for clients that have to go there to do the assessment. But then if clients don't have like a lot of the clients that we work with don't have the funds to like go there, then that can be really difficult. Like, so it just doesn't, and like it just doesn't feel as accessible as it should be. As well as like having to wait forever like on hold. And I was like, when you're like an older adult that like maybe you have some like memory impairment and like hearing impairments, like it's just doesn't feel very accessible.
Yeah, thank you for sharing that. So kind of what I'm hearing is like the system navigation of systems.
Yes.
Yeah, that's important. That's one that's been coming to mind for me as well, especially with Transit Plus. And Serena left a comment in the chat. Partnerships should be a focus. Yes, partnerships is a keyword too. I don't know if Melanie is here, but Melanie, did you have anything to add from that group?
Can you hear me?
Yep, we can.
Oh, okay. I mean, I've been looking at this for a while as far as the shopping shuttle goes, and I really think it's a bigger problem. I think it needs to go, like Connie Newman was going to take it to the city to get some policymakers involved. I think that it boils, at the end of the day, it boils down to the financial. People can't afford transportation, so the government needs to step in.
Yeah, so affordability, that's a word that is key. I know a couple of people now have touched on the grocery shuttle aspect of it. Because those are private businesses, who do you feel, obviously we as organizations are important to advocate for those services, but what does that alternative option look like? Because if we can't force private organizations to provide a shuttle to the grocery store, does anybody have any thoughts around like, what else? How do we solve that grocery store problem? Melissa, I think you had your hand up.
Yeah, I wasn't in this group. And forgive me, I shouldn't do this, but always when I think tons, I'm always thinking more rural than Winnipeg. And what I'm about to offer is pretty Winnipeg focused, but
Oh,
and
no.
it's also a little bit of a shameless plug, but MLPD came up with a seniors resource guide. We just launched it a few months ago, and we didn't really look at options that would take people to grocery store, but there are a number of grocery stores that deliver for fairly reasonable fee.
Mhm.
And sometimes that works out better for folks that are worried about like getting from their home to the transportation in winter when it's icy and things like that too. Yeah. There are a few options that I know food fair is one people often use in my area, but I think there are a few others. I haven't looked at the guide in a while, to be honest with you, but I know there's a few options in there for folks. Yeah.
I think we're looking at a bigger picture as well, though. Like, it's also an outing. It prevents isolation. It gets these seniors out of their apartments, and opportunities to connect with people in their community. So socialization, exercise, and opportunities to access stores and services on their own, right? On their own. So it's
Yeah.
not
I hear
eating
that
is
too.
yes, groceries are important, yes, and I appreciate that. But it's more than just bringing food to the door. We want to get people out.
Yeah, that's an important theme, very much so, is that social isolation. Thank you for sharing that, Melissa. And perhaps actually, I will share that guide. I'll email you after and I can share it out to the group if you're okay with that.
Actually, if anyone wants physical copies, people love the electronic copy, but we went to the trouble of like printing English and French ones. So if anyone wanted like physical copies to give out to people, please reach out to me or reach out to Samantha or reach out to me. We're like begging people to take the free physical copies at this point because everyone wants it electronically.
We'll take
Yeah.
them. We'll take boxes.
Awesome! Yay! Okay.
Yay.
I'll facilitate that connection in the email to follow up after this. So thank you so
Thank
much for that.
you.
Printed
Yeah.
is so important too.
I think when it comes to advocating, though, as far as policy goes and getting help from the people above, it's promoting this whole, I mean, the World Health Organization is all about, social prescribing, getting people out. This is just as important as people's vitals. We have to present it in a larger scope, not just getting from A to B, it's getting people out of their apartments.
Yeah, I love that perspective. I think it is so important. We underestimate the isolation piece of all of
Huge,
this. It
huge.
is very huge. Thank you very much for sharing, Melanie.
Thank you.
I will move on to group number 2. Was there anything that stood out for group number 2? That was Vivi, Kathy, and a phone number, which I don't know who is. If you have any comments or thoughts to share on your priorities, anything that stood out. And if there's no one from that group, that's okay. Let's go. Also, you can just put your hand up if I move on too fast, but let's go to room number 1, who is Justina, Kirby, Louise, and Melissa. Was there anything that came up within your group as priorities or thoughts?
Yeah, this is Kirby. And I think we really started out with, like Justina was talking, really about the most vulnerable populations and the most underserved. They're encountering the most barriers to transportation. And a lot of it is kind of centered around a lot of medical models to access to mobility devices, because without an access to a mobility device, then they cannot access transportation. So really tying in, I think, some key components. And I think that personally, I see that medical model of disability creating barriers with Transit Plus and like people not having access to a family doctor or encountering occupational therapists who, I don't know, like question their needs, I guess, and just like how there's just multiple barriers to even be able to access the transportation. And I think we could really remove those. Melissa commented about how we have a new government right now. And so there should be a lot of space for us to make some noise and start putting some collective pressure and conversations to this new government. Because also, if anyone didn't know, there was a silent release of the Accessibilities for Manitobans Act's transportation standard. So you can find that on the Manitoba Accessibilities Office's website, the final standard, which is the 3rd of 4th going forward. And kind of maybe we should be talking, this is my own personal thought, about the lack of accountability within that standard. There's no reason why any organization providing transportation for seniors or persons with disabilities or anyone that needs accessibility accommodations has to follow through with that standard. There's kind of no clear roadmap for organizations that might want to follow the standard. And yeah, I don't know if anyone in the group would like to add to that, but those were my notes from our conversation.
Those are great points, Kirby. I appreciate that a lot. Silent indeed. I definitely did not see the release of that. So they were very silent about that. Thank you for bringing that up. I do have a question actually to follow up for you. An interesting point, medical models and access to mobility devices. Can you speak to that piece a little bit more? Do you have any other thoughts with that?
Melissa, am I putting you on the spot if I ask you to speak about that better than myself?
Okay, I can take that
Or
on.
Justina as well.
Unless Justina wants to, I can take that on. For me, when I think about medical models, so without getting to the end of the whole medical model versus social model of disability right now, medical model is kind of this idea that disability should be seen primarily as a medical condition as opposed to one created by barriers in the environment, to give like the one sentence version of that. And when I think of medical model and the problems with that, there tends to be this idea that everyone has access to a family doctor, everyone has access to specialists, And when we put that barrier in place of access to services, that creates problems for a lot of people. So why do you need to have access to a doctor or access to an occupational therapist to access accessible transit? Like,
Mhm.
yeah,
Yeah, that's a really
thank you
key.
for the nod. If you don't mind me adding, Kirby, it just came to mind as we were discussing like the grocery options and all those things. So for those of you that might be familiar with the Manitoba Accessibility Fund, or what might be called an MAF grant, it's a fund facilitated through the Manitoba Accessibility Office. And it's meant to fund projects that are related to the standards that are out, which I find interesting now that the transportation standards out, because they don't offer a lot of money for these grants. I think they cap out at 25,000. And I think they're a little bit sticky on offering capital stuff, but it does occur to me that there may be some options there for projects relating to transit for folks that those grants, I think they're due in March. So for any of you that are interested in maybe exploring some transportation options, that might be an avenue, because they've always said to us, well, we can't cover anything that's not relating to a standard that's not out. So in the past they would only cover things related to the standards that had already been released. But now that the transportation standard out, that may give some folks an avenue to pursue funding there.
Yeah.
And thank you for commenting, Kathy, about the budget. I think that's a really important point too. I haven't seen too many meetings out yet, except for the one in Brandon,
Mhm.
but I'm keeping an eye.
All great points, Melissa. Thank you so much for sharing that. And that actually made me put a note for a presentation with MAF, because if they did release the transportation standard, you're very right with that. Now projects should be able to focus on the transportation piece more specifically. So, oh my gosh, great thoughts, like great feed. But where you said you shouldn't need a doctor or physio to access accessible transit, that's like a one-liner that I'm like, whoa. Anyways, sorry, I put a star beside that. I appreciate that. And I think it's so, yeah, like I've heard Patrick from ILRC often talk about the medical versus social model, and there's so much on both sides of it. But yes, that was very, very important. MAF grant opened yesterday and they only spend the interest every year. The Manitoba government earmarked 22 million. Oh, interesting. Okay, I will send that out as well as a follow-up. Sorry. Okay, I think we have one group. Oh, you guys have great thoughts. I love doing this. Okay, I think we were at room number 4. Correct me if I'm wrong, if I didn't. Simran, Karina, and Ray. I'm not sure if Ray is here or not.
Yeah, Ray joined us almost close to the point where, the time was almost done. So he wasn't able to contribute, and I'm so sorry about that. Karina was able to provide a lot of good points. And if you're okay, I can speak to those, but if you want, you can also go ahead. Let me know, Karina, how would you want this to?
You can do it.
Cool. Okay, so I think from our group, what Karina has mentioned, because for me, it's really important to.
Oh, I think your mic went muted. Sorry. There you go.
Okay, can you hear me now?
Yeah, it's a little bit muffled, but I can kind of hear you.
Is it better now?
Yeah. Yeah, I think if you're just closer.
Okay, so I will be touching base on mainly focusing on what Karina has mentioned, because it's really important for me to discuss her points. She raised really important concerns coming from the perspective of rural side and transit, and when it comes to accessibility to affordable transit, when coming from rural areas to city, especially for medical appointments and stuff, and how expensive it could get for people living in rural areas. And I think this is really a big concern because when it comes to development and availability of medical facilities, people will have to commute. So affordability, not just for the people who live within the city, but also when we are connecting the rural environment with the city. So affordability is definitely one of the prime concerns, and we have to highlight the fact rural transportation, accessibility and reliability of transit, how often they can rely when people are commuting from rural areas to cities for their needs, and those could be basic needs. And it also involves the right to enjoy, which is recreational activities, going to, like some of us have already mentioned and highlighted, how important it is to socialize and exercise. Those were all of the points that have been raised, even some of the comments that were made about why do we need medical models, super strong intervention when it comes to accessing accessible transit. And I completely understand that. These are valuable discussions, and I think we need to have more of this. And I cannot thank you enough for organizing this think tank and for everyone to actually come here and discuss openly what are the needs and what are pressing concerns. I think safety is another aspect, and this could come in handy when it comes to the accessible mobility aids and access to those. And I know that some of us have already mentioned regarding the same, but safety could go into many variations. So those could, and I think this is like, we need to have more of these discussions so that we can talk about what entails under these different main key points, which is accessibility, safety, affordability, because it means different to each individual user.
Yeah, so many great points in there. And thank you. Like, you hit some really good keywords of reliability and safety and the multifaceted nature of safety, because you're right, it does mean something different to everybody. Was there anything else, Karina? Did you have any thoughts or anything that we missed? Or Simran, from your perspective, in your job, did anything come up for you as a top priority?
I will first let Karina speak if she has something to add, because this is her time too. And if she doesn't, then I'll go ahead.
Well, to add on to what's already been said with regards to conversations with the new Manitoba government, I was in attendance at the AMMs in the fall, and one of the things they pointed out in the minister forum is when they're talking about improving healthcare in Manitoba, that includes all aspects of healthcare, not just staffing with nurses, doctors, and healthcare aid, but they did reference that transportation, because another issue for us in rural communities is that airport services and having a airport up to code or standards and maintained, which has become a huge cost burden, so those medic flights can come in and out. So they did actually mention that that includes transportation, not just that airport factor, and making sure there's some funding to support that option for getting patients from one location to another, but also that ability locally in the rural communities to get our citizens to their appointments. So to me, that also included handy van and other transportation models. So to them, as long as we're speaking in the language of healthcare and improving healthcare, that's maybe some of the lingo we need, as well as what's already been touched on, is that focus on improved life. So the quality of life, because that's another thing. So if our seniors are shut in because of affordability, accessibility, reliability, let's tap into that whole getting them out, which gets them active, gets them moving, and meets those social and mental health criteria on the health spectrum kind of thing, for that quality of life and keeping them in their own homes as long as possible. So that's some of the language, I think that moving forward and having those conversations, we'll want to make sure are included.
You hit some really great points. Like everyone, you guys all have great points, but right before our meeting, actually, this is something that Tons has kind of zeroed in on, is that the new ministers, the new government, but also the amalgamation with health and seniors and long-term care. One thing that we noted within that was that unfortunately seniors weren't mentioned a lot within it, but it is to the advantage that health is kind of now under that umbrella, because you're right, without transportation, really health is, yeah, you can't access healthcare services. So very, very, very good points. And I had some good thoughts that came out of there. Do you have anything else to add? Does anybody have any thoughts that came up from those previous comments? Is there anything that we went the full spectrum? Some of the key words that I heard within today are kind of that advocacy, education, partnerships is really key. Yeah, advocacy was still, that was kind of in there, the reliability, the safety features of it, opening those discussions with key partners. We could go into a whole, that might have to be another Zoom or another think tank, and God, we can do a think tank on each of those points. But was there anyone from any other groups that had thoughts or points? I think there's no hands up. We are coming on 1 o'clock, and the one, I don't want to leave you guys hanging with that, but the one question that I do want to leave with, we all brought great points. Everyone had valuable perspectives. You guys come from organizations that do a lot of this great work. Leaving here today, knowing that we all pinpointed some priorities and identified some solutions or thoughts, what can you commit to doing in leaving this think tank today? So if you want to take a moment to reflect that, this doesn't have to be something you share to the group, but what is an action that you can commit to in supporting what we talked about today? And I'm sure many of you may have already established some of these things in your organizations, but if you would like to share, I would love to hear it too.
I can share like a small thing that I would hope is useful in the future.
Yeah.
My realm is health in some way, as sport and recreation for people with disabilities, and I feel like that includes, you know, seniors as well. And I'm kind of slowly doing an audit of all the accessible sport and rec programs and organizations offering it and stuff like that. But through those conversations with organizations, I am finding adapted vehicles owned by organizations that are often sitting unused and or maybe misused once a week, kind of a thing. And so I'm hoping to have a little chunk of that kind of information available and seeing if that's something that we can collectively use in the future, and instead of having to rely on the current systems that we have in place. So I don't know, don't get too excited, but like I'm just compiling the information, and so we know we have it.
No, I
And
love
maybe
that.
it can get used. Yeah.
Thank you so much.
And then I think, what else did you ask? Oh, about what we can do. I think I'm actually curious as far as like people in this room that have a bit of power and actionability. I feel like it would be Simran, and they're in a brand new position as accessibility coordinator with transit. And so I guess my question would be, what can we do as a community to support Simran, and what is her, like, I don't really know what the role allows. You know what I mean? Like as far as like actionable change, but I think it would be nice if we knew what we could do to support her in her role, because she has access to some pretty high up people, I think. So that's my thought.
Yeah, that's a great one. That's a really great one. Simran, you put in the chat, I'll share those ones. I'm taking a lot to think and work me through the discussion policy initiatives, collaboration initiatives to enhance tailored accessible transportation service, educational initiatives for both users and drivers is super, super, super important. Karina is committing to advocating for handy van services to be reviewed at the council level. So we look at how we're using it, whether it's truly meeting our citizens' needs. That's really important. Kathy is going to commit to letter writing, attending town halls, and bringing the issue of gaps in affordable and accessible anywhere I can. Accessible transportation. Sorry, I missed that. Heather, you have your hand up. Thank you for everyone.
I didn't get quickly writing in the chat. I'm a retired pediatrician. And one of the aspects of my life that bugged me a lot was having to do camp physicals. And I always said that was a barrier and a barricade that was really unnecessary. And as the Canadian Medical Association is looking at advocacy for system improvement, I really appreciated the comment of Melissa about the medical model versus the social model, and that doctors and OT should not be gatekeepers for accessing transportation. So that was another good example for me in my world of trying to reduce the number of barriers that physicians are historically just been put in place, like camp physicals for children to go to summer camp. The parents should be able to do that much better than us. And I think that there's many other examples that I like to bring forward in my other world of post-retirement.
That's wonderful, Heather. Camp physicals, that's very interesting. Yeah, but those were some really great points. And thank you for re-highlighting the medical social comment that Melissa shared. I appreciate that. Does anybody else have any actions and thoughts? Anyone popping up? I know we have a few people who are not visible, but that's okay. My actions following this, I'm going to share the recording with everyone. So you can go back and listen to the parts that you want to listen to. I'm going to summarize the points that I need to send back. I'm going to look into setting up a presentation with MAF regarding their transportation accessible, all of that component we talked about. I'm going to share the links that we put in the chat because some of those are very important. I will actually also compile some of the comments that are in there because I think they're really important and I don't want to lose them. And I have a whole list of great things, but definitely setting up more. Melissa, did you have a comment?
I did. I kind of hesitated because I wasn't sure what the appetite was for this sort of thing. Then I saw Kathy's point, and then I was like, I want to commit to like any kind of town hall and thing we can participate in. I think it'd be great. I think it's always better when there can be like a group of us speaking to the same issue on this sort of thing. Like show that there's like, I don't know if any of you are familiar with FAN, the Family Action Network, but one of the things that always impresses me about them is they show up as a group, and even if they're only one of them speaking, it always makes the point that there's like more than one person who cares about this issue. And I really think that's a good way. Like there's a group of us here, so let's take advantage of that and support each other where we can. Samantha, I would also and I guess I should ask Serena, if I can just quickly mention the snowplow campaign for the Winnipeggers.
Yeah, of course,
That's
please
okay.
do.
So there's some of us and they're like Kirby, and unfortunately we haven't had the pleasure of meeting with Serena yet, but we will. Who've been a part of organizing this what we're calling the snowplow campaign. It's Winnipeg specific, sorry, but it's to try and encourage the city to do a better job of plowing those sidewalks. And we've been waiting for a decent snow to launch it, and now we have some snow. So I think we're gonna be getting ready to launch it probably next week. So please look forward to that. And even if you're not in Winnipeg and you get inspired by it and want to do some of your own thing, I don't think any of us will be offended by that. So
Yeah,
I-
that's a good, I like that, Melissa, and I definitely will share even things that are urban centric. I put something together a couple years back about snow plowing in the rural areas, but whether you're in the urban area or a rural area, snow looks the same on streets and
Yeah.
sidewalks. So we will definitely share it. And thank you for your work in putting that together.
Thank you. I forgot to explain what it actually is. What we're asking people to do is like either take a picture or share their story through a form we've created about what the sidewalk snow barrier is. Like, tell us where you are, where you see the barrier that hasn't been cleared, and basically compiling all of those stories, because often what we find is that the sidewalk story gets told by other people as though if it's just a few bad experiences. So we're trying to collect all these stories and photos in the same place, just sort of point out like maybe there's particular neighborhoods where it's more of an issue, or maybe it's widespread throughout the city. We don't know, but it's kind of that power in numbers thing again that we're doing.
Yeah, I love that. And stories and lived stories really often drill home to neighbors. One of the things that happened a couple years ago, I think it was related to bus issues, but they got local stories and real lived stories. And I remember a counselor in the city was like, "Oh my gosh, that building is right next to where I live." And in that moment, it actually drilled home to him like how much closer some of the issues are than he can actually sometimes conceptualize. So lived stories is so important. And I think that's one point I put down is kind of how do we continue also, because we connect to service providers, how do we continue to bring the voices of people who actually are living out some of the challenges that we often talk about? So that community engagement piece of it.
Samantha, it's Vivi. Can I just interject?
Oh yeah, of course.
So Melissa, CNIB is just about to launch a similar thing. So I'm really happy to hear you say that, because our campaign is called Snow Way. And it's exactly what you're talking about, to bring attention to the inaccessibility of snow-covered sidewalks, bus stops, accessible parking spaces, and we're about to launch that next week. So Samantha, I'll probably be reaching out to you and Melissa, to you, to share with your networks. And we want the same thing, to take a picture, post it on your social media, tag CNIB, so that we have a record of this, particularly for people with sight loss. But of course, we want our allies in the larger community to assist. And this is Manitoba-wide. It's a Manitoba-wide campaign. It's actually a countrywide campaign. We may be having a contest for the least accessible sidewalk, bus stop, accessible parking space in the country, and there may be a monetary prize. So any support we can get, we are happy to have, and we're happy to have allies working on this with us. So Melissa, I'm really excited to hear you say that too.
Vivi, I'll send you the invite to our next meeting. I think we should have you there, because we've been collaborating as a number of organizations to do this, and we want to work kind of with other, or not kind of.
Yeah, exactly, alongside. Yeah, and I'm
Yeah.
we're just waiting for our internal documentation to be ready to share, which will come next week. So when I hear from you, then I'll share out what we've got, and yeah, we can totally see how we can make this bigger and better for both of us.
This is awesome. Great connections. And you know, with some of these topics, and I think I've talked to a few people, the support, the collective support in going and connecting about these issues is so important, because like they can be exhausting year after year, especially when it comes to snow, but they're so important. So thank you guys for connecting. One question that I did have, and I've been pondering, for those who are in attendance, I know there's a lot of urban folk, but do you guys feel value in separating urban from rural, or do you like the shared connection? Because I know some of you are provincial, some are you urban focused. Does anybody have thoughts on that? And I could do both. I can do different options either way.
I personally don't mind the idea of mixed, just because I'm thinking from provincial organization level, and or CNIB was just speaking, so they're more federal or national, but that puts a lot on them to potentially be attending both rural and urban to offer contribution, and therefore they might only be able to make one or the other. So from that level, I would prefer to see both kind of a urban and rural.
Awesome. I like that. Yeah, that
Yeah,
is a really good point.
I agree, Samantha. It's Phoebe, and like going forward with our strat plan for the next 5 years, the transportation piece, we do definitely want to emphasize the needs in the rural areas because the urban areas are being addressed. Of course, they're not always being improved, but we are definitely looking at the rural needs, and that is something that's our focus in terms of our safe and accessible journeys piece of the strat plan in the next 5 years. So I don't mind like having a combination of two because it'll help me in my work when I go back to the regional and national teams to say what the needs are and strategize about how we can address them.
Awesome. That's great. That's great to hear. At Tons, we have very specific like deliverables related to like rural handy van programs. So Karina, I can connect you in with that realm so we can talk more, but I appreciate that. So I'm kind of gauging the feel. Anyways, we are 12 minutes after. Did you guys find this valuable? Is it helpful? Do you like the connections and conversations? And if I can ask one action of you beyond the beautiful things that you guys shared, do you think for our next one, sorry, my brain is not working. I don't have a set date, but it's going to be within the first week or two in February. Could you share this invite and this event information with someone in your circle who you feel they need to hear the conversation, they need to open up to collaboration, or just would be a great voice? That's my request. I'm hoping we might have a little guest speaker, guest mentor for the next one as well, but we will also always try to engage these or have these collaborative conversations. So if you want to give me a thumbs up or like an emoji if it was helpful, then I can know we're on the same page and it's not just me that likes them. Awesome. Okay. And I know there's some people that are away from their phones. So thank you all. Like, this was great. This was really invigorating. Yeah, there's some great people in our community. We have great advocates and great supports. So look forward to an email from me with the recording. And if you want to go through it, I encourage you, and I'll send all the links and comments. Thank you for today. And thank you for starting January off in a wonderful way. And I will end recording.